All right, hello everyone. We're going to start this webinar. My name is Nalani Jenkins. I'm the COO of Lawson and Associates, and I'm going to keep my part brief and turn it right over to Tracy Lawson. She is the president and founder of Lawson and Associates, Inc., and she'll be the host for today. Tracy?
Thank you, Nalani. I just wanted to pop up and show my face here for a second before we start. I wanted to say mahalo to GCA Hawaii for sponsoring this free webinar, and especially to Cheryl. We're going to ask Cheryl to say a few words here in just a second. But I also wanted to thank the executive committee, the COVID-19 committee, and the safety committee. We have a lot to go through in an hour today, so I'm going to keep it at a good pace. At the end of the presentation, we will be putting this recording on both GCA Hawaii's website and also Lawson and Associates website, so you can pull it down on demand. We'll also include a copy of the presentation and some other resources for you to use as you move forward in this issue. So without further ado, I'm going to move to the next slide. And Cheryl, are you with us?
Hi, Tracy. Yes, I am. Can you hear me okay?
Yeah, yes, we can.
Okay. I don't want to take up too much time. I really want to get to the meat of your presentation, but I wanted to say thank you to you, Tracy, and to Nalani for doing this. And to our members who are listening, I cannot stress enough how important it is to put these type of safety measures in place. There are other cities around the nation that have had their private construction shut down, such as New York City, Detroit, the Bay Area, California just got shut down. So it is really, really imperative that we demonstrate that we can work safely through this pandemic, or we'll be in the same boat with them. So please, after you listen to this webinar, take the time to prioritize putting the safety protocols together on your projects. And if you have any questions about anything whatsoever, challenges you're facing throughout this pandemic, that's what the association is here for. I think you all know how to find me or Gladys, so please feel free to ask any questions or seek any help that you need. And with that, I'll turn it back over to Tracy. Thank you.
Thank you, Cheryl. So I just want to add to that, we've been watching the news, we've been listening and talking with our peers, and I just saw an article come out today from Nevada OSHA that they're going out and enforcing social distancing and monitoring for that. I do want to remind everybody that we do, out of the executive order and the emergency order that was issued, social distancing is a requirement. And I'm going to share a little bit of experience within this last month. We've been dealing with over 5 instances where we had either suspected or unconfirmed or confirmed positives related to construction and job sites. And in each case, it would have been really nice to be able to say, hey, we can show that we were not in close contact. And that's going to be a key element in today's discussion, is for you to be able to make the right decisions is understanding was close contact experienced or not. And so I can't emphasize enough for everybody's personal health, and also for the abilities of our essential business to continue. If let's project that OSHA, high OSHA here is going to follow suit to what Nevada is doing, and so on. We're very visible. We need to keep our workers healthy. We need to keep their families healthy. And this is serious times and serious change in behavior as we watch these numbers rapidly rise. It is a real issue, and it demands everybody's very serious sense of urgency and attention. So let's start off just with a quick refresher. I'm not going to spend a lot of time on this because I really want to talk to what do we need to know as employers, and how do we make our decisions for our businesses and our workforce safety. But let's just review what coronavirus is. And actually the term coronavirus really describes a broad category of viruses that affect people and animals. So according to the U.S. Center for Disease Control and Prevention, this coronavirus was identified back in the mid-60s. And it's really a common cause of our colds and upper respiratory infections. which I just want to point out and remind everybody that as of today, antibiotics don't have any effect on viruses. So this infection, and it's often called the SARS-CoV-2 or COVID-19, same thing, interchangeable, but this SARS-CoV-2 is actually the virus that causes COVID-19, and it can cause illnesses that range from a mild to severe effects, and in some cases we know it can be fatal. Unfortunately, we just experienced our first fatality here in the state for someone who had other medical complications, but also was positive for COVID-19. So we want to flatten that curve as everybody's hearing the discussion on the news and the medical professionals talking about. So these symptoms typically with COVID-19 or with coronavirus can include fever, cough, shortness of breath, and some people who are infected with the virus have reported experiencing other non-respiratory symptoms. And other people who we refer to, if you hear the term asymptomatic cases, those are folks who are not experiencing any symptoms at all. So according to the CDC, the symptoms of COVID-19 may appear in as few as 2 days or in as long as 14 days after their exposure. So this COVID-19 is a new strain of the coronavirus. And evidence suggests that it may have began from an animal to person transmission and then has shifted to person spread. And people who are symptomatic are the most frequent sources of this COVID-19 spread. And that's true whether it's the flu or colds. COVID-19 data to date suggests that 80% of the infections are mild or asymptomatic with no symptoms at all. 15% are experiencing severe symptoms, which may require oxygen, and 5% are critical, which are requiring ventilation. And so the percentage of severe and critical infections are higher for COVID-19 than influenza. And again, there is no current vaccine for COVID-19. We know there's a lot of tests taking place right now. And there's a lot of discussion that people who have already had coronavirus, including COVID-19, may get it again because this particular strain has mutations. So important to know a little bit of facts of this. So how is it transmitted? So I mentioned on the previous slide that there's likely a belief that the first human case of COVID-19 resulted from infected animals to people. And then people to people continued the spread. And so the virus is thought to mainly be spreading from person to person. So this can include people who are in close contact with one another within, we keep hearing this 6-foot threshold, through respiratory droplets produced when an infected person coughs, breathes, or sneezes. And these droplets land in mouths or noses of people who are nearby or can be possibly inhaled into the lungs. And so then it may be possible then that a person can get COVID-19 by touching a surface or an object that has COVID-19 on it and then touching their own mouth, their nose, or possibly their eyes. So those are your routes of entry. This is not, however, thought to be the primary way that the virus spreads. So people are thought to be the most contagious with COVID-19 and when they're the most symptomatic. So they're experiencing a fever, they're coughing, or they're having shortness of breath. And some spread might be possible before people even show symptoms. And I know there's been a lot of discussion about taking temperatures and other things. And I think that's really important to remember. Just because someone does not have a fever does not mean that they are not carrying COVID-19. So there have been reported transmissions with people who are asymptomatic, having no signs and symptoms. But this is not thought, again, to be the main way the virus spreads. So although we have in the US implemented public health measures to limit the spread of the virus, like social distancing, it is likely that some person-to-person transmission will occur, and we're seeing that. Okay? So let's talk about surfaces for a second. Going below the surface a little bit, this slide was from Avetta. I've been attending a lot of webinars myself just to make sure I have the most current information. And I thought this was a great slide, so I'm sharing it with you. So how long does this COVID-19 last if it spreads onto the surface of different materials. And so they're saying that for wood, studies are showing that it can last up to 24 hours, same with cardboard, stainless steel and plastic up to 72 hours. And for fabrics, we don't really know, but they think that it generally that it lasts for a shorter time period compared to hard surfaces than these fabric soft surfaces. So something to keep in mind. So CDC is suggesting that we wash items using the warmest water that's appropriate and then dry them completely. And for surface cleaning, you can take a cup of bleach to a gallon of water. And later on, I'll also talk about other EPA approved cleaning products. So let's move into what OSHA has provided for us as employers as a guidance on preparing our workplaces for COVID-19. I will also let you know that we give you a link to this publication, and we've also put it on the website already downloaded for you to have access to the publication. They say they can't see your slide. You can't see my slides. Can everybody see the slide now? If I could get somebody to chat to me to make sure you can see the slides, I'm going to keep talking. Okay. All right, so what are some steps that all employers can take to reduce risks of exposure? And I'm going to spend the most time out of all slides on this one. I have 5 steps here. And the first one is to develop an infectious disease preparedness and response plan. Now, this is not required by OSHA. This is a recommendation. And some of the things, that OSHA publication will give you more detail, but some of the things that they're recommending with this plan is that it should consider and address the levels of risk associated with various work sites. In the next few slides, I'm going to talk to you about the 4 different risk levels for different types of workers to help you determine what types of steps could be taken in those sites, and especially we're focusing on construction sites. The other thing is that we should follow federal and state recommendations regarding the need for social distancing, maybe staggering of work shifts, downsizing our operations, if we're able to deliver services remotely or parts of our services remotely, and any other exposure reducing measure that's appropriate for your business. The second item is to prepare and implement basic infection prevention measures. And for most of us, that means protecting workers. We'll have an emphasis on our basic infection prevention measures. And as appropriate, all employers should be practicing and implementing good hygiene to begin with. And that includes infection practices, primarily promoting frequent and thorough hand washing. I sent out to our staff about 2 weeks ago a great YouTube video, and encouraged everybody to do a demonstration on the job site or show this video on how to properly wash your hands. Some of you may be surprised. In fact, we'll probably put that link up on our website for everybody as a resource, but you may be surprised at how a quick 2-second wash that I know we see sometimes really doesn't do the job. And so if we're going to wash our hands, we need to make sure that we do so properly. You know, we're being recommended to wash for at least 20 seconds. And this doesn't just include our workers, but if you're at a location where you have customers or visitors coming to your site, you want to have a place for them to wash their hands. So if soap and water and running water are not immediately available, then we should look at providing alcohol-based hand rubs, and those should contain at least a 60% alcohol content. We also want to encourage workers to stay home if they're sick. I'll probably repeat this several times throughout this presentation, but my experience so far this month has been that more than half of the exposure concerns that we've had are related to employees and workers who are coming to work sick. And maybe under normal circumstances, that may be something that some workplaces see as a good thing. And you're pushing through and you're coming to work because we got to get the job done, right? Just get it done. But in this current state, in this current condition and pandemic that we're going through, if workers show up sick, they could actually be shutting the entire company, if not job site, down. And so it's really important to change our thinking. We want to encourage respiratory etiquette, but that includes covering our coughs and sneezes. And they tell you to cough into your elbow, the crook of your elbow, not into your hands. And this is important, and this is the spray area for a cough or a sneeze. This is why we have this 6-foot distance. with our social distancing. You want to provide customers and the public with tissues or trash receptacles. And we should really explore as an employer whether we can establish policies and practices like flexible work sites. I know there's a lot of people telecommuting, working remotely, flexible work hours, staggering shifts, anything we can do to increase the physical distance between employees and the density of our workplace. And even the distance between employees and others, if other people are coming into our work areas. We want to discourage workers from using other workers' phones. One of the incidents that we had this month with our company dealing with had to do with someone used the phone of a worker who came up positive, and then then people were in contact with that person. And so it's important that we look at sharing equipment, tools, phones, desks, and other devices, and we really start to segregate that and sanitize if we need to share. Maintain regular housekeeping practices, routine cleaning, disinfecting surfaces, our equipment disinfecting. If you have an operator, your equipment's running around the clock and you have 2 or 3 different operators who get in that equipment, they should be disinfecting when they get out and when they get in. When you're choosing cleaning chemicals, I mentioned this earlier, please consult the EPA's approved disinfectant label, and they have a list of approved disinfectants that they can fight these viral pathogens. So you can go to the EPA website and they can provide you that information, and follow the manufacturer's instructions for the use of all cleaning and disinfecting products. Some of these may require PPE. Interestingly enough, reading the directions on our disinfectants, we found that most of us spray a surface and wipe it clean. Many of these disinfectants have to sit on the surface for 60 seconds or more in order for them to become effective. And so it's really important that we don't want a false sense of security that we think we've disinfected, but we just haven't done it according to the requirements of the product. Number 3, we want to develop policies and procedures for prompt identification and isolation of sick people as appropriate. So we'll talk about this more throughout the presentation, but prompt identification and isolation of potentially infectious individuals is really critical in protecting our workers, our customers, our visitors, and anybody else at the work site, and our families that we go home to. So employers should be looking to inform and encourage employees to self-monitor. So everyone should know what the signs and symptoms are. We're going to go through that today. And they should be reporting if they suspect a possible exposure. We ran into a condition this month where someone was sitting in their truck and we walked up to talk to them and they were self-isolating with a fever in their vehicle. That's just not acceptable. That person should be at home in isolation and getting proper medical care. Okay? Protect workers in close contact. So if they're more than within 6 feet of a sick person, if they have to have prolonged or repeated contact with that person, we should use additional engineering and administrative controls. I'm going to talk about those on the next slide. Those are common terms that safety professionals use when we're evaluating risk and what controls should be put in place. And I've created a COVID-19 hierarchy of controls for us to use as a guideline. Number 4, develop, implement, and communicate about workplace flexibilities and protections. So we want to actively encourage sick employees to stay home. We want to make sure that the sick leave policies are flexible and consistent with what the public health guidance is and laws are saying, and that employees are aware of the policies. I think the unknown can create the most panic and discord and discontent more than anything else. It's being suggested that we not require a healthcare provider's note like we normally would if someone was out sick. And the reason for that is the healthcare provider offices and facilities may be extremely busy and they may not be able to provide that documentation in a timely manner. So you might want to consider that. We should be flexible with our policies that permit employees to stay home and care for a sick family member. In fact, we have a law that came out to talk about that. Employers should be aware that more employees need to stay home and care for children or other sick family members than may be normal in the course of employment. Recognize workers who have ill family members, they may need to stay home. and be aware of workers' concerns about things like pay, leave, safety and health, and other issues that come up during these types of outbreaks, like our jobs, right? Provide adequate, usable, and appropriate training, education, and informational material about business essential job functions. People need to know what the new rules of the game are. They need to understand the seriousness of this. We should be talking about this on a continuous and consistent basis. I have a slide coming up also that talks about how to communicate. And this absolutely includes proper hygiene practices. You know, I mentioned a minute ago about how to wash your hands properly. And, you know, maybe under normal circumstances, you might be like, that's ridiculous. That's a critical factor in avoiding and protecting from contracting this virus, is keeping our hands clean so we don't transmit what's on our hands from the surface we touched to our mouth, nose, and eyes, which is the route of entry. So informed workers who feel safe at work are less likely to be unnecessarily absent. They understand what's expected, they understand the facts, and they can see that the employer is consistently walking those out. And so the last one are the workplace controls that we need to implement. And in the safety and health world, I mentioned we use a system that's called the hierarchy of controls. So this approach, I've taken this normal slide that we would use for our training from the ANSI Z10, and I've actually changed it and called it for COVID-19. And I just gave some examples following this hierarchy. So this is really a process that we select ways of controlling workplace hazards. So in other words, the best way to control a hazard is to systematically remove it from the workplace. And we start from the top of the chart with the most effective means and work our way down to the bottom of the chart to the least effective means. And it may be a combination of these controls that gets put in place. We should not be relying on workers to reduce their exposure on their own and expecting that they know what to do. Even if you've said it once, we need to repeat, repeat, repeat. So during an outbreak like this, when it may not be possible to eliminate the hazard, wouldn't that be nice if we could? Our most effective protective measures with COVID-19 involve engineering controls, administrative controls, and safe work practices. And I've given examples in all of these, but these three, engineering, administrative, and safe work practices, are very important. And safe work practices, for my safety professional friends, we know that that's a type of administrative control. And then our last choice is PPE, our personal protective equipment. I will say this about masks. I know there's been a lot of different discussion from the Lieutenant Governor to the Surgeon General to what CDC is saying and what OSHA requires. OSHA relaxed for healthcare workers their respiratory fit testing for the N95 masks. N95 masks, an N95 filtering face piece is a respirator. It's the lowest level of respiratory protection possible, and it is a negative pressure respirator, which means it can put pressure on the body's lungs and cause aggravation of existing medical conditions. And so these face masks that everyone is talking about are the surgical type masks, the ones that you see the doctors wearing or you see people walking around sick wearing. So everything that I'm reading is that if you want to wear a face mask and you can actually find one, that's up to you. Consider your own medical conditions and anything that could impact from that. But recommendations still from the CDC are that these aren't effective in preventing exposure. In fact, they feel like it makes people touch their face more frequently than we already do. And there's some studies say that, you know, we touch our face 20 some times a minute, and that's excessive just in a normal circumstance. Okay, so with regards to respiratory protection, I really encourage you to talk to your safety professionals and get more information before you start issuing these PPEs out, because there, as with everything, there are positive and negative consequences, and what we're being told by the medical community is in terms of what's effective versus what we feel is effective may be two different things. So please do more of that research on your own. In most cases, like I mentioned, we're going to need a combination of these control measures to protect workers from exposure. So I mentioned earlier that OSHA has identified different worker exposure classifications, and there's this occupational risk pyramid. You'll see very high and high exposure. Really, these two categories are for people who will be in close and frequent contact with persons who have COVID-19, and it specifically calls out healthcare industry. Medium to lower risk is actually where construction, and lower risk are administrative and office support personnel. Their risk exposure should be classified, or most likely is classified in. And so this medium risk has jobs that require frequent or close contact within 6 feet of people who may be infected with COVID-19 but are not known or suspected patients. And this is in areas where there's ongoing community transmission, like our own community here. And workers in this category may have contact with the general public. They could be in high population density work environments like construction sites if we can't control that. And some retail settings like going to the grocery store. Lower risk really is jobs. These jobs are ones that don't require contact with people known to be or suspected to be infected with COVID-19. And they're not frequenting or being in close contact, for example, within 6 feet for a time frame of no more than 10 minutes of the general public. And so workers in this category have really minimal occupational contact with the public or other coworkers. So let's talk about this medium exposure for construction and the steps to protect our workers. And there are a lot of general steps that I mentioned already that apply to any classification, and that includes the social distancing, our hand washing, our covering our mouth if we cough, and keeping our surfaces clean. So I'm going to just put that aside and say that applies to any category and all personnel, okay, in all circumstances. But for medium exposure, additional risk steps to protect our workers, we're on the job site. We have meetings, we have safety meetings or tailgate talks or gatherings. We should really keep it to no more than 10 people. I had one job site just the other day. We talked about doing roll call instead of passing around a sign-in sheet, so everybody doesn't have to touch the same surface and the same pen. Establishing this social distancing protocol is so important. We've been auditing job sites and talking with clients and really focusing on social distancing, and there are and more often than not, cases where workers are not focusing on this and they could keep a distance of 6 feet. I'm not going to sit here and say it can be done in all circumstances easily or with no impact, but that needs to be the goal. I mentioned earlier, I just read an article this morning that Nevada state safety and health officials are out reminding construction firms to follow these social distancing practices, and the Nevada OSHA has sent letters to employers because the agency found workers at job sites were allowed or even instructed to work in close proximity. And so we should take an advance warning and notice from this trend that if that's already hitting the news, if I see it, other people are seeing it too. So establishing these effective protocols, we need to ensure that these social distancing protocols are maintained during the operation of our mobile service equipment. That could be equipment that's designed to take 2 or more passengers, like a scissor lift or a man lift. And in these cases, we need to really be disciplined with the workers about keeping separation, and when they need to be closer, making sure they're not closer within 10 minutes, because that's our close proximity criteria that we're dealing with. Some other steps we can take to protect our workers: providing cleaning or sanitizing supplies to just clean common surfaces. I know these are getting difficult to purchase and to find, but consolidating our resources and make sure that they're available for these high surface contact potential areas and equipment. That includes shared equipment, shared tools, providing access to potable and sanitary water. Still disappointing that on a regular basis, we find no hand cleaners and no sanitizing means even outside of our sanitoys and our porta potties on the job site, which is an issue regardless of this pandemic, but especially now. Maintaining 6-foot separation protocols if you're transporting your crew in a vehicle and they have to share and ride in the bus or a van, and making sure you're separated. Conducting daily surveys. I've seen a lot of contractors coming out with a survey verification checklist for COVID-19 that they're completing every day to monitor changes in the workers' health and status. And then ensuring that if we do have employees who may be first responders and who are going to provide first aid or medical services, let's make sure they have the additional PPE and equipment they need to protect themselves in the event that they need to give care, so that they can, and they can do so safely. There has been a lot of discussion on OSHA recordability of workplace exposure to COVID-19. So here's where we stand right now. I know AGC of America has been giving a lot of input and feedback to OSHA as well as a lot of other organizations. But as it stands right now, the record-keeping requirements mandate us as employers to record certain work-related injuries and illnesses. So COVID-19 can be recordable if a worker is infected as a result of performing their work. So if nobody else at the job site had been infected, we've been checking and detecting, and we've been maintaining our social distancing, and one of your workers comes to work and reports they're sick, in those circumstances, it may be difficult to tie it back and say, well, this is because of exposure at work. No one else is sick here. However, if you have allowed someone at work to be sick and have not been enforcing social distancing and the other practices we're talking about, and now your 3 or 4 more people are getting sick because of that exposure, that very well could be recordable. And so you're responsible to record these cases if the case is confirmed by a medical physician, and the OSHA website gives more details to answer your questions on what is a confirmed case. The case must also be work-related, and so you have to be able to verify. And in some cases, that could be difficult. In others, it may not be, like I just explained. And this case has to involve 1 or more of the general recording criteria. So it has to have medical treatment beyond first aid and involve days away from work, for example. So it isn't just carte blanche. You have to record it on your 300 log, but you do need to be aware of consequences besides everyone getting sick, and consequences that also relate to you having to record this as a work-related illness. Okay. So how do we communicate responsibly? Management leadership is key. I can't emphasize that enough. And it is so important to stay calm. I have just over this month received a variety of phone calls. First of all, none of us really have dealt with this level of situation, I think, in our lifetimes. So it's confusing, it's frustrating, it's scary, and we really need to make sure that as management and leadership, we keep a cool head, and especially our safety professionals. It is important to communicate frequently and consistently with the employees. I get told all the time, one of my responsibilities in my job as president of Lawson Associates is that I am the repeater in chief. I am to repeat our messages over and over and over, and I shouldn't get frustrated if I have to say the same thing several times. Whatever it takes for the employees to understand that this is consistent and that we mean it, and that we know what we're doing, it can give the employees a good sense of security and safety. We want to use reliable information, just the facts. And facts are changing on a daily basis. At the end of this presentation, I have given some resources that I'm using to keep on top of things. In particular, I really value the Fisher-Phillips collaborative team site. This is a variety of experts that are giving daily updates and changes on laws and conditions and recommendations for employers on what they should and shouldn't be doing. I check the CDC website. I check the Department of Health for Hawaii website. And I I check the AGC website, the American Society of Safety Professionals. There's a list of these sites that I'm continuously checking and looking for information on. And I think one of the ones that I found that's been very valuable is one that helps me dispel myths with facts. And the World Health Organization has a Mythbuster site. I've given you the link to this as well. And it's interesting to go on there, and it answers questions of what are some of the myths that are floating around out there that employees may believe to be true. And these are good things to talk about with our employees also. And the fact that it comes from a reputable site. We want to encourage employees to stay home if they're sick. That needs to be a responsible communication that we're having on a regular basis, so they actually know that it's okay to stay home and that they're not going to be penalized for that. And I mentioned this earlier, we need to talk about our sick leave. What is our policy? What are the things we're going to be able to do? And I know for our business, we had to sit down, and I'm thankful we were talking about this at the end of January, just watching what was going on and looking at our numbers for our business and saying, my gosh, if we don't have any work, what can we do? What can we afford to do? They just came out with the CARES and the payroll support bills for funding. Avail yourself to that information and understand what you can do to help your business keep going. Don't make promises you can't keep, but as a leader and a manager in our businesses, we need to know what is the message for our employers, because they either need to know yes, our employees, they need to know yes or no, or this is what it is, because that uncertainty can cause a ripple effect. And we want them to feel confident and understand what the plan is. Okay. I know I talked to my staff as early as February about, hey, I'm seeing this happening. I hope it doesn't get to us and become a pandemic. At that point, I said, I don't know what I can do yet. We're looking into this, but you should also be responsible to be saving and preparing for your own self and for your own families. And I think those are important, hard, but factual discussions that need to be had. And then if you are having workers remotely work, stay in touch. Our policy is if I'm paying you to stay home and work from home, you have assignments, we touch base with a Zoom conference, we're communicating on a regular basis, and they are showing me that they've either completed training, they've completed the assignment that they were given, and that they're getting any questions they need answered. And I expect if I call that they answer, okay? So it's a different world, it's a different circumstance, and these are clear policies and communications that will help us get through this with avoidable interruptions, right? Avoid the interruptions that we can. So let's talk about some important things that I know many folks have questions on. I've been taking calls all month on this, and I'm just a safety professional out there researching, making this information available. I've given links again at the end of this. This information is fluid. Who knows, tomorrow it could change, but this is what the current directions and advice and recommendations are for employers and employees. So number one, how do you know if there was an exposure? And the most important factor that should be the first questions that we're asking ourselves, and also should be the highest priority for us to ensure we're avoiding, is close contact. Generally, close contact is required in order to have transmission or to be at a higher risk of transmission. So what is close contact? If you're living in the same household with someone, you're caring for a sick person already. I've mentioned this several times. If you're within 6 feet of a sick person for about 10 minutes is the time frame in general that they're saying. And being in direct contact with secretions from a sick person. And this could come from being coughed on, kissing someone, sharing utensils, eating utensils. So that's close contact. So if there has not been close contact with a sick person who's been verified to have COVID-19, or we are presuming and acting as if they do, there's low risk for infection. Okay, and again, I want to reinforce this adds into those hand cleaning and hand washing and avoiding touching our eyes, face, and nose. Okay, employees can go to work, and they should monitor their health for 14 days from contact if they were around somebody but not in close contact. And they should stay home and away from others if they start to feel sick. Okay, these are the guidelines from the Department of Health that's out there and the CDC. So how do you know if there was an exposure? If you weren't in close contact, you can go to work. You should monitor yourself for 14 days from the time you thought you were in close contact. And if you begin to feel sick, then you stay home and away from others. Okay? What if an employee was in close contact, but they're not sick? Okay, so again, monitor health for fever, for cough, and shortness of breath. And during the 14 days after the last time you're in close contact with a sick person. And if you were in close contact, don't go to work or school. If you were not in close contact, you can go to work or school. Can you see how that's a big factor in determining what action and steps we take? Now, could you err on the side of caution and be extra cautious and say, I wasn't in close contact, but I just want to stay home? Sure, you can do that too. These are just the recommendations that are out there to help us make good, sound decisions. What do I do if our employee tests positive? Guidelines right now are saying that you should send home all employees who work closely with that employee to ensure the infection does not spread. So before that infected employee departs your work site, you need to ask them to identify all individuals who worked in close proximity. Again, that's within 6 feet for a prolonged period of time. That's 10 minutes or more. Anybody who's done that within the past 14 days to make sure you have a full list of those employees who should be sent home. When you're sending the employees home, this is so important, and this is legal protection here, is that you do not identify by name who the infected employee is. You could risk violating confidentiality laws, HIPAA laws, and if you work in a shared office building or area, you might want to inform building management so they can take whatever precautions they deem necessary. I know we have some companies out there who've been very busy doing disinfection and cleaning services for businesses that have been calling them in. So the CDC provides that employees who worked closely to the infected worker should then self-monitor once they're sent home for symptoms. These symptoms could include fever, cough, or shortness of breath. How long should employees who worked near the positive employee stay home? So the first thing is you want to consult and follow the advice of the healthcare providers or public health department regarding this. But if those resources aren't available, you can't find the answer, you're not being given them, then the general guidelines are that the employee should at least remain at home for 3 days without a fever. And this fever has to be achieved without medication. And if they don't, they shouldn't develop any symptoms without medication for 3 days. Okay? If they do develop symptoms, they should remain home for at least 7 days from the initial onset of those symptoms, and then 3 days without a fever, again, achieved without medication. What if an employee is suspected but unconfirmed? All guidelines are saying that we should err with an abundance of caution and treat the situation as if the suspected case is confirmed. And this is in relation to sending employees home who are potentially infected. We need to communicate with the workers, and that includes subcontractors and anybody else who is around them, and let them know that the employee has not tested positive for the virus. They were exhibiting symptoms, and that you are treating it as if it is a positive diagnosis until otherwise, or until they clear through the return back to work period. How do we tell between a suspected unconfirmed situation and typical illness? I have a lot of people, wondering about that. There's no easy way for us to make this determination, but we should really try and let logic guide our thinking a little bit. The kinds of indicators that'll lead you to conclude an illness could be a suspected but unconfirmed case of COVID-19. You could ask yourself and the employee, hey, have they or anyone in their household traveled to any of the restricted areas? Have they been exposed to someone who traveled to those areas? But ultimately, you should err on the side of caution and not panic. It is important to know that the EEOC has confirmed that you can inquire into an employee's symptoms, even if the questions are disability related. You could, as you would You would do this as you would be considered to have a reasonable belief on objective evidence that the severe form of a pandemic influenza poses a direct threat. And that's really important. So they're saying, based on the circumstances of today and this pandemic and the severity of it, the EEOC has ruled that you may attempt to distinguish between the symptoms of COVID-19 for that worker and just the seasonal flu. So this could include questions as to whether the employee has a fever. Are they feeling fatigued? Do they have a cough, sneezing, aches and pains, a runny nose, a sore throat, diarrhea, headaches, or shortness of breath? The most common symptoms of COVID-19 are fever and dry cough. So I have a helpful chart here that the CDC has put together to help us kind of determine the differences based on symptoms between a coronavirus, the cold, and the flu. So again, I want to emphasize that the most common symptoms are fever and dry cough. And I'm going to move on to the next slide, but this slide is available in the handouts we've put up on the website. What should you do if an employee was in close contact with somebody with COVID-19 and they get sick? So if they get sick with fever and cough or shortness of breath, even if the symptoms are mild, everything we're reading says that you should assume that they may have COVID-19. You should isolate at home, away from other people. If they don't have a high risk, like a pre-existing medical condition, but they want medical advice, they should call their healthcare provider and tell them that they were exposed to someone with COVID-19. The healthcare providers then can help them decide if they need to be evaluated or tested. And again, there's really no current medications that have been confirmed to treat this COVID-19. When do we discontinue home isolation? So same thing, we've talked about this a little already. So if you were sick and in contact with a COVID-19 patient, you can discontinue your home isolation if you have at least 3 days that have passed since you recovered and without the use of fever-reducing medications and you see improvements in your respiratory systems, and at least 7 days have passed since the symptoms first appeared. That's really the guidelines for us. A very helpful app that I want to tell everybody about can be downloaded for free at the Apple App Store, and I know they have it for other devices as well. But the Centers for Disease Control has an app that can help you go through and evaluate your symptoms, evaluate your circumstances, and determine what your next steps would be with COVID-19 and getting evaluated. So I thought it was pretty helpful and useful app. It's good for supervisors to have out in the field. So here's some resources for you. HawaiiData.org is a website that is keeping up to speed with Hawaii's current conditions and the status of our outbreak. There's the World Health Organization. This is the next one is the Mythbusters site. This gives facts in place of myths with regards to the coronavirus. World Health Organization also has some other health topics and information at the next third bullet point. The fourth one is the CDC's coronavirus website. The next three are OSHA websites. The 3390 publication that talks to you about how to establish those 5 steps that we talked about earlier in the presentation. There is a COVID-19 page that talks about what OSHA standards apply to this pandemic and that employers should be paying attention to. And then the record-keeping website that talks about if you have to record COVID-19 on your OSHA 300 form. AGC also has an excellent website set up for coronavirus. So does our GCA, and they're going to have links to this webinar and the documents there as well. And then Fisher Phillips, this is one of my favorite websites in terms of keeping up to speed on facts that are put out by a composite group of attorneys and professionals who are really helping direct good decision-making and keeping on top of this ever-changing, very fluid situation. So I want to take the next 10 minutes or so to answer questions. I see quite a few coming in here on the question and answer. So the first one asks, are there any specific requirements for the project site personnel to conduct temporary screening for workers? And I'm assuming this is talking about taking temperatures. There's 2 things. I've seen some construction companies coming out and they have a questionnaire that just goes through and asks the basic health questions that we're allowed to ask. I know GCA may have a sample of that for everybody that they could put up on their website. But the other one has to deal with taking temperatures. And while that has been exempted as being protected, my position for my staff is that we are not taking temperatures. I don't want my staff in close proximity, and we do not have access to the PPE that is necessary for me to protect my team. That doesn't mean other companies can't and shouldn't. I would encourage you to look at that Fisher Phillips website and do some of your own research before you determine if you're going to be taking temperatures or mandating that on job sites. I think that's a commercial decision for each company. The next one is, what is the OSHA stance on work in a manhole that requires 2 people? I think this is a difficult circumstance that we have to deal with as an employer. I think we need to try and maintain as far of distance as we can. I know 6 feet is recommended. I've seen varying distances from 3 to 6 feet. I think we need to achieve the best that we can and pay attention to time frames and pay attention to the health of those workers that we put in close proximity with one another. I'm not sure that I have a perfect solution for you. The other option is to decide whether or not you can and need to continue that work. And I think that's on a case-by-case basis. Let's see, can we use hierarchy of controls with the COVID-19 slide? Can you use it for yourself? Anything that we put out that we're giving you, those are just examples, but absolutely we're putting this material out there with the hopes that it helps people make decisions. But just know that that hierarchy of control slide is just a sample. See, can daily surveys of employees on health status be verbal or should it be in writing? I feel like if things are written down, you have a better position of what was asked and what was answered. And I think that you should confer with your attorney to ask what they think. For me, I would have it written down. If it's written down, how long should you keep it? Same, another question for your attorney, but I would keep it with their personnel records. I don't see any harm in putting it in a personnel file and kind of waiting till we get through this pandemic and know more information about what the long-term consequences could be and the impact for employers. So I'd hang on to it for a while. I know that's very ambiguous, but that's my answer as of today. But next question was, if an employee is in close contact with persons with a positive test, why is the return back to work period 3 days if there are no symptoms? The return back to work period, if you're in close contact, I think maybe go back and look at the slides. So what I said in terms of was in close contact and was not in close contact, because it's that time frame of 3 days without exhibiting fever and without exhibiting any illness without the use of medication. And then it's 7 days from the initial contact from that point in time. So those are the determinations. I have a couple other questions that came in on the chat. No, I picked them. Those have all been answered. One last one. You work in a marine environment. Is there a list of questions we can ask our crew members before they head offshore? There are questions you can ask for health purposes. There's some checklists out there. And we'll go ahead and put a link on our website to some of those questions. And I think a lot of the companies have already been developing these. And I think the GCA COVID-19 committee may have one available on their website as well. Construction is essential, but masks are in short supply and mostly available only to health workers. At yesterday's proclamation, it was noted that PPEs are required for inter-island travelers with virtually no availability. How do we handle this? Great question. I'm not sure that I have an answer. I feel, I discussed earlier that there's a difference between these, the face masks and between an N95. And I know that, there are a lot of people who are manufacturing these face masks, and there is a lot of disagreement and discussion back and forth as to whether those are effective. That's a great question. I suppose if you don't have the material that's required, then travel may be very difficult. So I wish I had a better answer for you than that. Maybe seeing if other people have resources that can be shared or purchased. Okay, we have about few more minutes. One more question coming up on chat. Let's see. So you said not to identify the sick person. What if that person is outside of the company? I think you want to be careful with HIPAA law and protecting people's privacy. And as an employer, especially, you should be careful not sharing those names. So if it's not your employee, I feel the same way. I think you should not be talking about who the person is and their names. We have laws that protect them from that. And I'm not an expert on the HIPAA law, so it's probably something you should look into more closely. But I've got to think that there could be consequences if you're spreading personal medical information about somebody outside your authority and without their permission. Let's see, another question. Even on job sites, workers may refuse to work due to a lack of masks. A worker can refuse to work, and the Fisher Phillips website has some good information on what to do if workers refuse to work, what to do if you've asked someone to go home who's sick and they refuse to do that. Our time was limited today, and that's why I'm providing that resource to you with some other good answers and scenarios in there that may be of value for you to answer some additional questions. And they talk about temperature taking and some of these questions about worker refusal. So they do have a right to refuse and to stay home. Let me check really quickly to see if there's any other questions here on the chat that I haven't addressed in the question and answer. So we appreciate everybody's time. I hope this was helpful. I know it was pretty quick and condensed with a lot of information in this 1 hour time frame that we had. The recording again will be put up on the gcahawaii.org site and the lawsonsafety.com COVID-19 page. We'll put some other resources in there for your assistance. We'll be having this webinar tomorrow as well. We had a overwhelming response to this, and so some people couldn't get into the webinar for today. If those folks are within your organization, we're going to be sending out an email and pointing them in the direction of the website so they can listen to this webinar. But if you can help pass on that information as well, we appreciate it. So I want to say thank you again to the GCA and to everybody who's participated. I hope this is helpful for you. And you know, let's all do our best to keep our business working and to keep folks going out there. Okay, thank you very much.